When considering from a policy perspective patient visitation hours, I think you really have to balance a collective of interests, so patients, families, and healthcare providers. Patient, family, and staff safety is a big one. And so that can look like anything from monitoring infection prevention control, monitoring who comes on and off the unit. Just the after hours monitoring from a safety perspective can be a bit difficult too. It may require additional staff to monitor access in terms of who's coming into the hospital.
C5 also is a locked unit, so we would have to be able to have staff to unlock the doors to allow patients to come and families to come in and out. It does come with many challenges, some very difficult challenges in regards to crowd control, who we allow to stay, meeting the care and needs of other patients. Some patients and families, it is very challenging for them to see their family members during our visiting hours. It might be their work schedule. We have had instances where people don't get off work until midnight, and in those cases, if it's prearranged, we do try to support that and facilitate that for the best of that patient. This is a trauma that brings them to the hospital. They don't know their care team before they come. They don't know anything about Sunnybrook, so that does lead to sometimes some more anxiety for the patients. So in those circumstances, we do allow some flexibility and allowing patients, families to stay later than the regular visiting hours or overnight.
There's plenty of literature that demonstrates it provides a great benefit to both patients and families to have open visitation. Some of the studies actually show that patients rest better in terms of in situations where there's open patient visitation, where it's not as restrictive, and that might be a bit counterintuitive to a lot of people. On the other hand, if family members can be here 24/7, there's the risk of caregiver burnout. So if there's not a mandatory time where they need to go home, there's the risk that they might overdo it and stay with their loved one to their own detriment. In the situations where we have 2, 3, 4 patients in a room, it's very difficult to maintain confidentiality when you can be having a team meeting at the bedside to include the patient, and yet you have someone quite literally a foot away from you.
Most of our rooms are shared with other patients. They're also very small. They're quite tight. We don't have the ability to allow people to relax. We don't have room to put down a bed or a cot.
I think it's important to note that exceptional circumstances such as a critical care admission, a dying patient, or birth of a child, those are treated as unique situations, while every illness is very impactful to patients and their family members. These are situations that are treated uniquely, and that we do have much broader flexible visitation and do adapt to those situations.